take a look at some of the health headlines. Joining us now is Dr. Lauren Streicher, a
Morning, Dr.
professor
Streicher.
at Northwestern University Medical School. I think we're contractually obligated to say
You
that.
are.
So you are.
My contract is Streicher.
Well, thank you for being here. And so first of all, we're going to talk about sleep apnea and the rate of diagnosis for
Yeah,
that.
sleep apnea is very common, but it's very undiagnosed. And why is it so important? Well, what sleep apnea is when the muscles in the back of the throat actually get looser and they can obstruct the airway. And what happens is when people are sleeping, they actually stop breathing. And then that lack of oxygen goes to the brain, quickly wakes them up. And what it means is not only do you get a terrible night's sleep and you're tired the next day and you can be confused, but it's also associated with more serious conditions, heart conditions, etc. And the problem is that a lot of people think, okay, you have to be overweight or you have to snore, and otherwise you couldn't possibly have sleep apnea. And while those are risk factors, there are a lot of others, and it's really underdiagnosed, both because, quite frankly, doctors don't recognize the other factors, and people aren't bringing it up. They think, well, it's kind of normal. So this is what to remember. Remember, stop, as in stop breathing. Do you snore? Are you tired the next day? Has anyone ever observed, has anyone observed you stop breathing, and do you have high blood pressure? Those are the 4 things that you need to ask yourself. And we're talking how much snoring is significant. Well, if someone can hear you on the other side of the door, then it's significant. And then we look at the physical signs that we look at. So we look at, okay, BMI, are you overweight? Definitely a risk factor. We look at your age. People that are older than 50 are at risk. Neck. Guys have a neck that's greater than 16, 17 inches. That's a risk factor. And then gender. A lot of people aren't thinking about this, that men are at higher risk than women until women go through menopause. And when women go through menopause, if they take estrogen, their risk does not go up. It's protective. But if they don't take estrogen, their risk is as bad as the guys. So bottom line, if someone is tired, if they're just not functioning, go to your doctor, talk about this, and if they kind of brush it off, be a little pushy, because it needs to get diagnosed, it needs to get taken care of. It is serious.
All right, let's talk about blue light glasses.
Yeah, you know where I'm going with this one already. You know, these blue light glasses that are very pricey, and a lot of optometrists recommend them, and the idea is that you filter out the blue light, and then when you sit in front of your computer all day, you're going to have less eye strain, you're going to sleep better at night. Some people say it's even going to prevent macular degeneration down the road. And the question is, do they work? Well, they finally did a good study, 600 people, half of them wore their blue light glasses, half of them did not, and no difference between the two in terms of eye strain at the computer, in terms of sleep, the macular degeneration they didn't look at because that's long term. But this is what got my attention, other than the fact that you shouldn't be spending your money on these blue light glasses, is it turns out the amount of blue light that emanates from your computer, it's about 1/1000th of what you get just by walking around on the street. And these glasses are only filtering out between 10 and 25%. So even if it turns out that that blue light is going to make a difference in terms of eye strain and all that, these lenses are not going to make any difference. So save your money, and if your optometrist is still saying buy them, say not so much.
Thanks,
All right.
And we've heard about women getting Botox in their early 30s, but now we're seeing women in their 20s. And what's the motivation
Barbie
for that?
Botox.
Wow.
Barbie Botox. 11 million hits on TikTok for Barbie Botox. And as you just said, these are young women in their 20s, but they're not getting the Botox where you think, because the wrinkles on their face are not the problem. Women in their 20s don't have wrinkles on their face. They are getting their Botox, wait for this, in their back. In their shoulder muscles, the trapezius muscles back here. And why? Because if you make those muscles relax, it makes your neck look longer, like Barbie.
brother.
Never even guessed that.
I hadn't either. I had to look this one up when I heard about Barbie Botox. And it's big. I mean, and the thing is the truth is that the legitimate plastic surgeons, they're not doing their stuff. They're not on board with this. They do that kind of Botox for people with headaches and other medical issues, but not for 20-year-olds who want longer necks. Who's doing it? It's these danged med spas, where you just because someone has an MD after their name and they're the ones holding the needle doesn't mean they know what they're doing. A lot of people will do a lot of things for money, and evidently Barbie Botox is one of them. The danger other than the obvious of like stupid and spending money on
Yeah,
all of
lots
this.
of money too, yeah.
Right, is that if someone overdoes it and if they don't know what they're doing and if they get the muscles that are next to those muscles,
Yeah.
suddenly you can't lift your shoulders. You're walking
Wow.
around like this.
Yeah.
Yeah, only for a few months, but still.
Yeah.
Still.
No, you're not getting the look you were trying to attain
This
there.
is
Yeah.
not a good idea.
Wow.
Yeah.
Maybe they should spend that money on a psychologist instead of a plastic surgeon.
I think that would be an excellent idea.
Just an idea.
Wow, I'd never heard of that before. All right. You can check out Dr. Stryker on social media. Dr. Stryker, thank you very much.
Thank you, doctor.
Thanks.
Hey, send a message to Pat and Paul. They want your text. Here's the number.